Hello, everybody. I hope you'll bear with me as I start to try and do some health videos on YouTube. Um, the first of these is actually about B12, and specifically, I'm just going to dive in there and try and explain something that has dogged both patients and doctors when it comes to diagnosing B12 deficiency and or pernicious anemia. What tends to happen is that a patient would, for example, have depleted red cells if they had had both either or a B12 deficiency or the blood disorder, which is slightly different, pernicious anemia. But the symptoms, the presentation, and the treatment might be the same, although with just a normal B12 deficiency that didn't involve non-absorption of B12 in the gut, then they would just be given ordinary pills for that, good supplements of B12. Why is it important to figure out which it is? Well, because the latter one, the B12, not the deficiency, but the blood disorder pernicious anemia can be fatal if it's not treated correctly. And the reason for that is that the B12 deficiency suffered by people who have pernicious anemia, I can hardly say it, who have pernicious anemia, causes depletion in red cells, but also in somebody who has just the deficiency but can absorb B12 from the gut would also have depleting red cells. Do you see what I'm trying to explain? It's quite complex. Now, someone could do this, which is they could have depleting red cells but have a high level of B12 in the system because they were taking supplements. Now, that problem would be defined as something that had to be sorted out quite quickly. And the reason for that is that it's kind of obvious. If a patient has been taking supplements, then in a false way, their blood would look like the B12 had been elevated, and therefore that there might be no B12 deficiency. But when the blood is seen and counted, there is still depleting red cells. Now, if a patient presented like that with high B12 in their blood, but they still had depleting red cells, it would be regarded that the test would look at the cause of the depleting red cells. Okay, so therefore, where do you go from there? Well, a test has to be done to determine if it isn't pernicious anemia. And the only way of doing that, because of the disease, whereby pernicious anemia is a situation where patients don't absorb B12 from the gut because a thing called peritoneal cells don't exist, if you like, in the stomach. And those cells are the ones that absorb the B12 and take the B12 to the liver and all the other organs in the body, plus obviously the blood. So without it, what happens is a chain reaction whereby the red cells start to deplete. And in a situation like that, what you would have to do is figure out what's going on with the patient, because if it isn't pernicious anemia because they lack those things in the gut which will allow them to absorb B12, then it has to be something else. So doctors will have to try and figure that out too. And therefore then what you have, a situation where red cells are depleting might be caused by something else. It could be caused by a list of other things, which is cancer can cause anemia and depleting cells. Other things like, for example, being a celiac, whereby the gut can't absorb B12 because it's interrupted by an intolerance to wheat. That's very common. And or something like a parasite, for example, from salmon, could cause a B12 deficiency and or pernicious anemia. But I run ahead. I therefore need to explain what pernicious anemia is, because what it is not is just a B12 deficiency on its own. Pernicious anemia is actually where the gut is missing two things, the stomach is missing two things. Intrinsic factor, which is also the thing that helps carry B12 into the blood system and the liver, and then also a patient would have antibodies to peritoneal cells. And it's those cells that are the important ones that absorb the B12. So in actual fact, two things can be going on, whereby the test has to be, in order to find out why is it a patient would present with high B12 because they were taking supplements, but to continue to have depleting red cells. Now, normally the judgment by a doctor would be that that person may have pernicious anemia, and they can only decide if they have it by taking the antibody test and also checking how much intrinsic factor is in the stomach. And then they would go on to get the levels of that, find out if there are antibodies, and pretty much as soon as if it was positive, then that person would be diagnosed with pernicious anemia. But as well as that, they might also go on to check other things, like, for example, depleting cells could be caused by bleeding as well, somewhere else in the body that would be creating the anemia. Okay, I think it's important to have explained that, because I think a lot of people don't understand the importance of getting a proper diagnosis, because it would not be true to say that someone who was high in B12 but continued to have depleting cells and other factors in the blood that would be indicators wouldn't have pernicious anemia. And then on the other scale, people who have B12 deficiency don't necessarily have pernicious anemia, because their test might be that they were negative for intrinsic factor and for absence of peritoneal cells, because antibodies were killing them. So if they didn't have absence of that and they still had intrinsic factor in their guts, but they had a B12 deficiency, and it could be shown by the tests that they were absorbing B12, then they would just be given supplements of B12. And the best supplements are actually at the moment a thing called methylcobalamin, which is the best transporting B12 and the most modern that they have found. And the way to do that, the best way to do that would be sublingual tablets that you put under your tongue. The best one for that, because they provide it in the form of methylcobalamin, is Solgar. And I don't have any sponsorship from them to say that, but in my experience, having had pernicious anemia for 20 years, I would say that they were the best form of it at the moment. There are also other things you could do, like patches, which would help to give absorption in one way, shape, or form. Might not be perfect, but there are better patches these days also that are methylcobalamin, and that would definitely help. So that could be done, as well as obviously the person taking the B12 supplements that the doctor might give them. And if they were defined as being able to absorb B12, then they would just go on to take those tablets until their B12 went into a good area of, say, 500 Ugs or mils, or whatever the scale is. that is usually between 150 and 1000. And then after that, the doctor might say it was fine, but it could take some months for that B12 level to elevate. And during the time that the patient would have been B12 deficient, all the other things that are presented, if you like, in pernicious anemia would happen to that patient. They would be very tired. They would obviously have anemia, and it could affect things like the nervous system and even the myelin sheath if that B12 deficiency had gone on for, say, 5 years or something like that and not been picked up. So it's very, very important that that diagnosis is made and made correctly. So that's why I decided to start these videos with that explanation. And it does cause upset for the patient and for the doctor if this is not done correctly. And it can have very bad consequences whereby pernicious anemia isn't diagnosed and the patient carries on and the doctor carries on thinking that they're high in B12 and doesn't address the red cell depletion. And that's, of course, the first thing they could look at, because they're called macrocytes. And normally with pernicious anemia, you'd want to count them and make sure that the B12 was being absorbed. And in the case of pernicious anemia, that would only be via B12 injections. There's no point in giving somebody with pernicious anemia tablets because they can't absorb those tablets in the gut. Waste of time. So therefore, injections, lifelong injections are diagnosed for the patient, whereby they get 1,000 mils every month, ideally, and or in this country every 3 months, which I would argue isn't enough, but that's the subject of another video on another day. And therefore, they would always need and require to have B12 injections, just simply because their gut can't absorb B12. And there are different types of injections now on the market, and I will look at that on another day. Thank you for listening, and I hope this uploads. Bye for now.